Hello, and this is my presentation for my project, which is materials for teaching medical imaging students in the operating room. So the purpose, it's a professional project created to solve the issue of medical imaging students being ill-prepared to work in the operating room upon graduation. So currently there are no classes inside the National Curriculum of Radiologic Technology for medical imaging students to learn how to function and work in the operating room. And so my professional project is a 5-week course to teach medical imaging students to work in the operating room. The course builds the skills of students from basic communication to independently completing procedures. So my first module is operating room terminology and communication. So they learn about 500 new terms, medical terms that are used inside the operating room, not only to communicate with the doctors, but also movements of the machines and what they're called. So I incorporate some case studies and also some reading to connect the material. In Module 2, Equipment and Technology, the students will log on to an online format and virtually learn how to, through an online virtual landscape, how to move the machine and how to complete procedures that way, and basically to simulate procedures. In Module 3 is where they actually, perform procedures in a simulation format in our on-campus laboratory where we have the machines that they can practice with each other. And also the final portion of Module 3 is where the students actually go out into the hospitals and participate in surgeries with registered technologists. And also by the end of that portion of it, they'll be independently performing examinations, being of course supervised by professionals in the field. So the way I assess them is they take some, quizzes and tests on terms, and also, I test them on case studies, which is usually right from the patient's chart, so they can transcribe certain terms to figure out what they mean. And Module 2 is competency-based, so they're going to go on the online program, which is Shaderware, and participate in simulated online procedures that they have to complete to pass and go on to the next section. So in Module 3, they're going to face the final exam, and also we have competency-based testing to where they are tested when they're on the on-campus simulated surgery. So we're going to do a competency-based evaluation there, and then also when they are inside of the hospitals, the registered technologists there that they're working with on real patients will also be assessing their skills there. So in conclusion, this 5-week course prepares medical imaging students to work in the operating room, designed for the most common procedures graduates will face. I use the universal design for learning model to create my 3 modules, which a portion of this is using an online management system and of course our online campus laboratory. So this course is designed for non-traditional students, largely, it's largely presented in a hybrid format. And the course can be offered as a 5-week summer course or expanded into a 15-week course based on the needs of the program. So future work and dissemination, I'd like to present this course on a national scale to see if it can be incorporated into the national curriculum. So I can use my local, state, and national associations in radiologic technology to get this information out there. And in the future, hopefully more programs and online services will be available for students to log on to do different procedures. And I'd like to incorporate some of the 360 camera work there too, so students can record and view surgeries on a 360-degree format, so they can learn every step of the process and what people do in the room. This project was exactly what I wanted to research and present. It's applicable to where I'm at now with teaching, and I'm in the works right now trying to get this course off the ground. I already have all of the equipment that I was awarded through a grant, so now basically I just have to get this through curriculum review and get the program started, at least starting on a with the 5-week, and then hopefully it can be incorporated to a full 15-week course. So thank you for watching, and I had a great time. Thank you.